This segment is sponsored by WellMed. Every year millions of Americans discharged from the hospital are actually readmitted within 30 days. But according to the Agency for Healthcare Research and Quality, effective transitional care can actually lead to some better outcomes. So joining us now to talk about it from WellMed is Dr. Jason Nichols. Hey, Dr. Nichols, good to see you.
Good morning. Thank you for having me.
Okay, so let's talk about why this is happening. Why are the hospital readmission rates so high?
Yeah, that's a great question. As you mentioned, 1 in 6 Medicare patients who are admitted to the hospital will be readmitted within 1 month. So it is a massive problem. The number one reason for that is lack of a coordinated transition process once you've been discharged. And at the top of that list is not having a good follow-up plan with your primary care physician. They are the quarterback of your healthcare team. They can help you coordinate visits across the healthcare system. So if you need to be seen by your cardiologist or your nephrologist, who's your kidney doctor, they can help you with those appointments, as well as discussing the disease states with them and explain that to you. Also, medication management. The number one cause of readmission within the first 3 days of discharge is actually around medication errors, either too much or not enough, especially if you have a new disease process that's going on or they're titrating medicines over a short window. Those are all common issues, and that's why the primary care physician is critical to helping with that.
That makes sense. I mean, it can be really confusing. You get all the paperwork when you leave, you try to follow it, and it doesn't always work. How can we reduce hospital readmissions and then just help people to be able to stay healthy at home?
I still go back to communication. I think that is so fundamental, especially with the primary care doctor, because you want to make sure that you fully understand and are comfortable with the plan that you've been given upon discharge. And that, to me, is really the biggest piece, is to make sure you understand the plan and you have a good follow-up with your primary care physician.
Definitely makes sense. Can you share some of those best practices for patients after the ER or urgent care visit? It sounds like primary care physician. Anything else?
Sure. Honestly, it involves just being honest. I think a lot of times patients are sometimes afraid and are scared to ask certain questions or even express that they may not understand the plan overall, or that they have difficulty affording medications, especially with the high cost of medications and everything going on. So really having those open and honest conversations with your provider to make sure they are aware of really everything that's going on. Because our job is to make sure that the patients, that you're gonna stay home. That truly is our most important thing once you've been discharged. And all of those things, they seem pretty small, but they make a big difference.
Yeah, we want to be going in the right direction. So do you have any tips to help patients really make sure that they're communicating with their healthcare providers?
I think one of the strategies I always recommended to my patients and families is to write questions, especially when you're in the hospital. You see a lot of providers, a lot of different staff. Things may not make sense. But you do come up with questions and write those down. That way, when you're following up with your doctor, that they can help make sense of some of the things that were done and stated and what that's going to mean in the long term for your health and for those disease states overall.
That makes sense. Okay, where can we go for more information?
You can go to agehealthytoday.com and it'll have more information about the transition process once you've been discharged.
Dr. Nichols, thank you so much. Really appreciate the chat.
Thank you very much, Jenny. Have a good day.
It's our pleasure. You too. So I want to remind you that we will have all that information on our website, cw33.com. And again, this segment was sponsored by WellMed.